The clinical implementation, clinical use of lecanemab started last year, December 20th, in 2023 in Japan. And so far, probably we have prescribed lecanemab to up to the 3,500 or more patients who have early symptomatic Alzheimer's disease, at the more than 500 clinical sites. We don't have efficacy data or impressing on the clinical efficacy yet, but what was striking and reassuring for us is that the ARIA rate was very limited, and it was lower than the clinical trial global data. For example, the ARIA E incidence in global clinical trial Clarity was 12.6%. But looking at the Asian population, including us Japanese, it was like 6% or so. And in the clinical use at this time, it is still limited to the 5%, including all cases of ARIA. So the uses are going quite safely. We have some special condition. That is, we need ApoE genotyping data, but by the limitation of the current use in the national public insurance, we cannot use the ApoE genotyping in the clinical practice. So now, in collaboration with post-marketing surveillance study that is taken care by the pharma company Eisai, we, academia, are now starting the patient registry clinical study. So the post-marketing study collects safety data, including ARIA, and then also some of the efficacy data, like MMSE or CDR. And then we, academia side, do the blood draw and then a genotype ApoE, and then probably we will extend the biomarker study, like including the p-tau217 as an efficacy marker, and then we share all the data together with the clinical sites and the government, and then we will extend to see how lecanemab is used, and what is the impact in the clinical use in Japan. So now we are starting to use the anti-amyloid immunotherapy, antibody therapy in the clinic, but it's not sufficient. Apparently, and then of course we can inhibit the initial phase of the Alzheimer's pathophysiological progression, by inhibiting the beta. But the cellular or neuronal phase, including tauopathy or related neurodegeneration, that progresses. So one thing I'm very much interested in how to inhibit the downstream pathway, for example, by the siRNA inhibition of tau production, or some other anti-tau antibody therapy. So I believe next year we will have much more discussion and new data coming from those expanded clinical trials.